Assalamu alaikum viewers, this is Dr. Khawaja Sajid Aslam, I'm one of the orthopedic surgeons. Today the public awareness program is about forearm fracture in children, or you can say forearm trauma in children. It's one of the most common problem among the children, especially when they get the school holidays and then they go for trampoline jumping and monkey bars and they had a fall and sustained this kind of injury. The most common among forearm is the supracondylar fracture, is distal part of the humerus, or the wrist fracture. Generally speaking, forearm fracture, especially these both bones, there are two bones in the forearm, radius and ulna. These two bones fracture or wrist fracture is, among the children, does not need any surgical intervention most of the time. The reason to do this public awareness program is many of the people, especially in Asian countries, they believe that we should not go to the doctor because every fracture, doctors, they deal with operative intervention. And that's not true. That's why I'm conducting this public awareness program, that most of the fractures in children, regardless, forearm fracture, even the arm fracture, wrist fracture, most of the fractures can be managed without any surgical intervention, can be managed just with plaster of Paris. That's why there is no need to get scared to go to a hospital, because there are little percentage of fractures which need surgical intervention or need correction or need plaster at least. But if you ignore that and if you don't go to hospital, don't take your child to hospital and keep on believing there is nothing wrong, then it might be something wrong which can give irreversible problem, which later on you cannot correct it, and deformity occurs, either is an elbow or forearm or leg. Just like yesterday, I did one operation of 14 years old child who had a fracture of the tibia, leg bone, 3 months ago, and they've been treated by local Sienna people, local Quakes, and they apply the plaster all the way from foot to mid-thigh. Knee was stiff, and the foot was in varus deformity. Foot was going inward, so it was a quite prominent, leg was not straight enough. So after 3 months, it's not possible to apply plaster in the right direction or correct this deformity. So he has to undergo for the surgical intervention. So we open it, remove it, cut it again, and correct the deformity. All I mean to say is, if he would have come earlier to an orthopedic surgeon or to me, this could be easily managed without any operative intervention. But plaster needs to be applied in a proper way, in a proper direction, so deformity wouldn't occur. That's why I'm one of the reasons that I'm conducting this program, that if anything happened to your child, don't be scared to go to hospital, or don't just keep on thinking that there's nothing wrong. So as I said, most of the fractures in children, they don't need any surgical intervention. We just have to correct the deformity and apply the plaster, and child can live good and healthy life for the rest of his life. Take care of yourself and your family, and especially the children as well, because children's decision, children's health, children's education, and their awareness is parents' responsibility, is our responsibility, because children, they cannot decide on their own. Take care of yourself and your family. If there is any question or you need further appointment, you can contact me. Thank you.